Certified phlebotomy technician. Significant points. A health occupation in which there is an extensive contact with patients. Job prospects should be very good, particularly in offices of physicians and blood banks. Nature of the work. The phlebotomist is a vital member of the clinical laboratory team, whose main function is to obtain patients' blood specimens by venipuncture and microcollection. The field of phlebotomy has greatly expanded in the past several years, and the role of this team member of the healthcare team has recently been brought into much sharper focus. The increasingly high amount of laboratory blood testing performed each day, the aging population, and the national shortage of registered nurses have caused a dramatic emphasis on the need for highly trained phlebotomists. Working conditions and physical effort. Work is performed in an interior medical clinical environment. Moderate physical activity may require physical effort, including lifting up to 25 pounds and some extended periods of standing or walking. Will work with blood or blood-borne pathogens and will require OSHA training. Description of the professional competencies. Phlebotomists are proficient in 1. Collecting, transporting, handling, and processing blood specimens for analysis. 2. Recognizing the importance of specimen collection in the overall patient care system. 3. Relating the anatomy and physiology of body systems and anatomic terminology to the major areas of the clinical laboratory and to general pathological conditions associated with body systems. 4. Identifying and selecting equipment, supplies, and additives used in blood collection. 5. Recognizing factors that affect specimen collection procedures and test results, and taking appropriate action within predetermined limits when applicable. 6. Recognizing and adhering to infection control and safety policies and procedures. 7. Monitoring quality control within predetermined limits. 8. Recognizing the various components of the healthcare delivery system. 9. Recognizing the responsibilities of other laboratory and healthcare personnel, and interacting with them with respect for their jobs and patient care. 10. Demonstrating professional conduct, stress management, interpersonal and communication skills with patients, peers, and other healthcare personnel, and with the public. 11. Demonstrating an understanding of requisitioning and the legal implications of their work environment. 12. Applying basic principles and learning new techniques and procedures. 13. Recognizing and acting upon individual needs for continuing education as a function of growth and maintenance of professional competence. A national certification exam is required for most states. Best American Healthcare University offers an online phlebotomy program for students in every state of the U.S., except for the states of California and Louisiana because of their specific state requirements. The student taking an online phlebotomy program would have to locate a facility for his or her hands-on blood draws. Upon graduation and initial employment, the phlebotomist will be able to demonstrate entry-level competencies in the above areas of professional practice. Description. This course provides phlebotomy instruction to the student with a working knowledge of collecting blood while emphasizing on patient safety, quality assurance, universal and standard precautions. Methods of instruction. This course utilizes a lecture, clinical laboratory, and demonstration methodology. Course contact hours. Minimum of 80 contact hours. Classroom and lab. Criteria certification. Students must achieve a minimum of 25 successful venipunctures and 10 capillary sticks. Students must achieve a passing grade of 70% on the National Certification Exam. Curriculum. Instructional areas. The curriculum must include instruction and experience in the following. 1. 40 hours of theory, classroom instruction. 2. 40 hours of applied experiences. 3. Performance of a minimum of 25 successful, unaided venipuncture collections. 4. Performance of a minimum of 10 successful, unaided capillary collections. 5. Instruction in a variety of collection techniques, including vacuum collection devices, syringes, and capillary skin puncture methods. 6. Successful completion of certification exam. Certified Phlebotomy Technician, CPT. The topics covered include the following: Introduction to Phlebotomy. Introductory courses that explain the function of today's phlebotomy technicians. This course identifies the phlebotomist role on the healthcare team. Students will be introduced to various departments within the laboratory setting and the role of each department. Learning objectives. 1. Demonstrate knowledge of the healthcare delivery system and medical terminology. A. Identify the healthcare providers in hospitals and clinics and the phlebotomist role as a member of this healthcare team. B. Describe the various hospital departments and their major functions in which the phlebotomist may interact in his or her role. C. Describe the organizational structure of the clinical laboratory department. D. Discuss the roles of the clinical laboratory personnel and their qualifications for these professional positions. E. List the type of laboratory procedures performed in the various sections of the clinical laboratory department. F. Describe how laboratory testing is used to assess body functions and disease. G. Use common medical terminology. 2. Communicate verbally and non-verbally, effectively and appropriately in the workplace. A. Maintain confidentiality of privileged information on individuals. B. Value diversity in the workplace. C. Interact appropriately and professionally with other individuals. D. Model professional appearance and appropriate behavior. Medical law and ethics. This is a course of instruction in principal procedures and regulations involving legal and ethical relationships among physicians, patients, and medical assistants. It includes current ethical issues as they relate to the practice of medicine and conformity responsibilities. Learning objectives. Define ethic, bioethics, and law. B. Discuss the measures a medical practice must take to avoid malpractice claims. C. Discuss the major points of the American Hospital Association's Patient's Bill of Rights or the Patient's Bill of Rights from the institution. D. Define the different terms used in the medical legal aspect of phlebotomy, and discuss policies and protocol designed to avoid medical legal problems. E. Follow written and verbal instructions in carrying out testing procedures. F. List the causes of stress in the work environment and discuss the coping skills used to deal with stress in the work environment. G. Demonstrate the ability to use computer information systems necessary to accomplish job functions. Anatomy, physiology, medical terminology. The overall objective of the program is to acquire knowledge of the anatomy and physiology of the human body. Includes an overview of the diseases related to each anatomical system. Functional concepts and internal structures are related to a basis for performing a physical examination. Course also includes an understanding of the language of medicine. Learning objectives. Demonstrate basic understanding of the anatomy and physiology of the body systems and anatomic terminology in order to relate major areas of the clinical laboratory to general pathological conditions associated with the body systems. A. Describe the basic functions of each of the main body systems and demonstrate basic knowledge of the circulatory, urinary, and other body systems necessary to perform assigned specimen collection task. B. Identify the veins of the arms, hands, legs, and feet on which phlebotomy is performed. C. Explain the functions of the major constituents of blood and differentiate between whole blood, serum, and plasma. D. Define hemostasis and explain the basic process of coagulation. E. Discuss the properties of arterial blood, venous blood, and capillary blood. Asepsis and infection control. A study of standard protocol for the protection of the healthcare worker and patient to assure that the procedure and treatment prescribed by the physician are safely and properly performed to assist the patient's return to health. Overview of causes and prevention of chain of infection. Learning objective. Demonstrate knowledge of infection control and safety. A. Identify policies and procedures for maintaining laboratory safety. B. Demonstrate accepted practices for infection control, isolation techniques, aseptic techniques, and methods for disease prevention. C. Identify and discuss the modes of transmission of infection and methods for prevention. D. Identify and properly label biohazardous specimens. E. Discuss in detail and perform proper infection control techniques, such as hand washing, gowning, gloving, masking, and double bagging. F. Define and discuss the term nosocomial infection. G. Comply with federal, state, and local mandated regulations regarding safety practices. H. Use the OSHA standard precautions. I. Use the prescribed procedures to handle electrical, radiation, biological, and fire hazards. J. Use the appropriate practices as outlined in the OSHA Hazard Communication Standard, including the correct use of the material safety data sheet as directed. K. Describe measures used to ensure patient safety in various patient settings, i.e., inpatient, outpatient, pediatrics, etc. CPR and first aid. The focus of this course will provide a general understanding the needs of the injured person, and in doing so, give care to the personnel. CPR and first aid. The focus of this course will provide a general understanding of the needs of the injured person, and in doing so, give care to the person, including CPR, until medical help is obtained. This module aims to illustrate emergency situations that may arise in a phlebotomist's daily routine, and the response techniques learners will be required to intervene appropriately during such circumstances. This course is not intended as a certification course for CPR. However, some training institutions require that students obtain their CPR, first aid training, before enrolling into their program. In such cases, they may not repeat this course in the program. Learning objectives. 1. Explain the purpose and value of the first aid and CPR training. 2. List the roles and responsibilities of the citizen responder and the professional rescuer. 3. Explain emergency action plans, first aid, wounds, shock, special injuries, sudden illnesses, poisoning, heat, cold emergencies, special situations that may occur during venipuncture, arterial, capillary collections. 4. List the symptoms of latex allergy and explain the appropriate action plan. 5. Demonstrate rescue breathing techniques for adult, child, and infant. 6. Demonstrate proper CPR techniques for adult, child, and infant, including two-person adult. 7. Explain the automated external defibrillator and its uses. 8. Describe appropriate first aid care for shock. 9. Describe appropriate immediate first aid care for complications during phlebotomy procedures. 10. Describe appropriate first aid care for sudden illnesses. 11. Express the ability to analyze and evaluate various emergency care situations. 12. Demonstrate self-confidence during practical testing of skills. Venipuncture. This course is designed to instruct the student in the proper methods of both capillary and venous blood collection. Equipment, legal issues, and specimen transport are taught and practiced. Proper methods of blood collections and processing are taught and practiced. Learning objectives. 1. Demonstrate understanding of the importance of specimen collection and specimen integrity in the delivery of patient care. A. Describe the legal and ethical importance of proper patient sample identification. B. Describe the types of patient specimens that are analyzed in the clinical laboratory. C. Describe the phlebotomist's role in collecting and/or transporting these specimens to the laboratory. D. List the general criteria for suitability of a specimen for analysis and reasons for specimen rejection or recollection. E. Explain the importance of timed, fasting, and stat specimens as related to specimen integrity and patient care. 2. Demonstrate knowledge of collection equipment, various types of additives used, special precautions necessary, and substances that can interfere in clinical analysis of blood constituents. A. Identify the various types of additives used in blood collection and explain the reasons for their use. B. Identify the evacuated tube color codes associated with the additives. C. Describe substances that can interfere in clinical analysis of blood constituents and ways in which the phlebotomist can help to avoid these occurrences. D. List and select the types of equipment needed to collect blood by venipuncture, capillary, and arterial puncture. E. Identify special precautions necessary during blood collection by venipuncture, capillary, and arterial puncture. 3. Follow standard operating procedures to collect specimens. A. Identify potential sites for venipuncture, capillary, and arterial punctures. B. Differentiate between sterile and antiseptic techniques. C. Describe and demonstrate the steps in the preparation of a puncture site. D. List the effects of tourniquet, hand squeezing, and heating pads on capillary puncture and venipuncture. E. Recognize proper needle insertion and withdrawal techniques, including direction, angle, depth, and aspiration for arterial puncture and venipuncture. F. Describe and perform correct procedure for capillary collection methods on infants and adults. G. Identify alternative collection sites for arterial, capillary, and venipuncture. Describe the limitations and precautions of each. H. Name and explain frequent causes of phlebotomy complications. Describe signs and symptoms of physical problems that may occur during blood collection. I. List the steps necessary to perform an arterial venipuncture and/or capillary puncture in chronological order. J. Follow standard operating procedures to perform a competent, effective venipuncture on a patient. K. Follow standard operating procedures to perform a competent, effective capillary puncture on a patient. 4. Demonstrate an understanding of requisitioning, specimen transport, and specimen processing. A. Describe the standard operating procedure for a physician requesting a laboratory analysis for a patient. Discuss laboratory responsibility in responding to the physician's request. B. Instruct patients in the proper collection and preservation for various samples, including blood, sputum, and stools. C. Explain methods for transporting and processing specimens for routine and special testing. D. Examine methods for processing and transporting blood specimens for testing at reference laboratories. E. Describe the potential clerical and technical errors that may occur during specimen processing. F. Identify and report potential pre-analytical errors that may occur during specimen collecting, labeling, transporting, and processing. G. Describe and follow the criteria for specimen and test results that will be used as legal evidence, i.e., paternity testing, chain of custody, blood alcohol levels, etc. 5. Demonstrate an understanding of quality assurance and quality control in phlebotomy. A. Describe the systems for monitoring quality assurance in that collection of blood specimens. B. Identify policies and procedures used in the clinical laboratory to assure quality in the obtaining of blood specimens. C. Perform quality control procedures. D. Record quality control results. E. Identify and report control results that do not meet predetermined criteria. Career development. This course is designed to assist the student in resume development, interviewing strategies, and decision-making skills to assist the student in obtaining employment. Optional externships are encouraged to offer the student the opportunity for real-life experience and additional on-the-job training. Performance objectives. At the conclusion of this course, students will 1. Present an acceptable resume using an industry-recognized format. 2. Present an acceptable cover letter and/or fact sheet using an industry-recognized format. 3. Present themselves in a professional manner for interviews. 4. Understand the roles of the interviewer and the interviewee. 5. Demonstrate appropriate interview behavior. 6. Demonstrate the ability to review and respond to appropriate help wanted ads in the newspaper. 7. Demonstrate the ability to conduct an internet search for jobs within their field. 8. Present a written thank you note for the interviewer.